Welcome to Breathe, Sleep, Heal, Live, a radio show devoted to helping improve your quality of life with Dr. Stephen Olmos and the team from TMJ and Sleep Therapy Center of San Diego. An educational program where you will learn about pain, sleep, health, nutrition, and more.
Welcome. This is Colette Settle and Dr. Farshid Ariz. We're here today from the TMJ and Sleep Therapy Center of San Diego. And we want to give you a little information about us and answer questions we've had from previous programs. People submit questions that we want to be able to answer and help with. We want to remind you that you do not need a referral to come and be a patient at TMJ and Sleep Therapy Center. And you do not need to be a patient to visit our website, email us questions, or call us. We're happy to answer questions before you make a decision to be evaluated, and we want to make sure you're aware of that. Our website is www.tmjsleepsd.com, and our phone number is 619-466-2774. We've been asked, what do I expect if I come there as a patient? And we want to share with you that our first visit is to do a comprehensive evaluation because our Dr. Olmos and our team goal is to find out the core problem that's causing whatever your symptoms of pain or sleep problems are. And so we start by unraveling the onion, as I spoke before in one of our other programs. By the way, if you have missed some of our programs, they are available on that website I just mentioned, www.tmjsleepsd.com, so that you could go back and listen to any topics or questions that you would like to hear about. Our first visit is lengthy because the doctors go step by step to determine the condition that you have so that they can direct appropriate care. And we want you to know how important it is to us that your experience with us is exceptional. Most of the patients we see have been struggling with their pain, inability for normal functions like chewing without pain, opening their mouth without jaw locking or cracking and making noises, sleeping restfully, having sleep issues. And this has all been going on for relatively long periods of time before they are either referred to us or they find us. Oftentimes, they've tried many different approaches, invested time and money, and understandably are frustrated and skeptical. We understand and we respect that, and we want to ensure that our patients fully understand what we are providing from the very first visit, that our goal is to find the cause and to be able to explain what's wrong, how we can help, how long it will take, why what we provide is different than the typical non-surgical treatments they may have had in the past or pain management, and give the patient all the necessary information to feel comfortable and to make decisions about their health care. We have questions, again, that we want to be sure and provide answers to, and Dr. Ariz is so good at that, so I'm going to call on you, Dr. Ariz, for a question from Sally from Poway. Sally says, my child started to have night terrors and is very moody. Why was I referred to a TMJ and Sleep Therapy Center? Good question, Sally.
Thank you again for having me, Colette. Question is, why do we have a child who is at night terror and is moody? Well, the night terror and mood swing in children can indicate a sleep-related breathing disorder due to improper or insufficient skeletal development resulting in insufficient airway. This can create a form of suffocation causing night terror and moodiness. Insufficient airway and lack of oxygen has also been associated with ADHD. Children with OSA or obstructive sleep apnea are frequently misdiagnosed as having an ADHD and are placed on unnecessary medication, unfortunately.
Thank you, Dr. Ariz, and thank you, Sally. That prompted really important information for parents or grandparents to have about the treatments that are being done that could be alternate treatments to medication for the children. And Dr. Ariz and Dr. Olmos are both extremely passionate about helping children. So please don't hesitate. Visit our website, www.tmjsleepsd.com, or call us at 619-466-2774. But John from El Cajon, we didn't forget about your question, and you're an adult, so that's good too. We help both children and adults. John's saying, what's so good about sleep? Why do we have to sleep?
Yeah, well, we need to sleep for many good reasons. For example, our body needs to sleep an average of 6 to 8 hours a night. So when we don't get our normal sleep hours, we get a lack of memory retention. Short and long-term memories are affected. And our body is not going to be healed properly if, let's say, we have an injury in our body, or joint, muscle ache, or what have you. So you need to have the downtime so that your body is able to repair itself. Does that answer your questions?
No, I'm smiling here because I can share with you that you need more of it as you age. I used to be annoyed that I had to sleep because I had so much to do. And when I was a student, it was to study and stay up all night, put in, what do they call them, all-nighters. And then when I had a job where I traveled and I had time changes, I couldn't sleep. And it really was annoying to me that I was supposed to get so much sleep. I wish I had known better then, because I think I created some of my own problems. But I am sleeping as I should now, and I'm mature. So I can share with all of you mature ladies out there, sleep's really important to us as life proceeds. Okay, Kelly from Santa Ana. She's asking, please explain, what is OSA, obstructive sleep apnea? I don't quite understand what that is.
Right. Well, the apnea in Greek means cessation of breath, meaning stop breathing. We measure apnea, we measure hypopnea. Hypopnea is partial collapse, whereas apnea is complete collapse of airway. What happens is the weight of the tongue and the mandible, when we are sleeping, when we are prone, it actually collapses on the airway, so the improper air is not basically going through the volume of through the lungs. So, for example, in men, it's been shown that 33% have apnea. In women, it's about 7%. Some staggering numbers are 90 million Americans are affected by snoring, which is a precursor of obstructive sleep apnea. 40 million Americans have sleep disorder breathing, which is a cause of other medical problems like high blood pressure, type 2 diabetics, obesity, cardiovascular, and other complications. 20 million have obstructive sleep apnea, and remarkably, 80% remain undiagnosed.
Wow.
Yeah.
Those are indeed staggering numbers. The benefit of sleep is something we probably need to pay way more attention to and make sure we're getting it through proper breathing, I'm sure. So that leads right into what Mary Beth asked. Mary Beth is here in San Diego, and she says, how do you know if you have a sleep disorder?
Good question, Mary Beth. I would say ask these 5 questions. Number 1, do you have sleep difficulty falling? Do you have difficulty falling asleep or staying asleep? Number 2, do you snore? Or number 3, are you frequently tired during the day? And are you aware or have been told that you stop breathing during sleep? And finally, is your sleep unfresh? Meaning that when you wake up in the morning, are you fresh? Do you drag it to, do you hate to get up in the morning because you need more sleeping hours? And if you answer yes to 2 or more of these questions, then you are at the risk of sleep apnea.
And that means you need to give us a call. We can help you. There are answers. It doesn't always mean that you have to wear a machine. You may be a good candidate for oral appliance therapy if indeed you've been diagnosed with a true obstructive sleep apnea condition. we all have to remember, if we startle awake at night, if our children startle awake at night, those night terrors, it's because our brain's telling us we're suffocating. We should be startled. Sleep is not overrated. That's kind of a change on a quote from Dr. Olmos often uses. It's very, very important. And if it's not occurring with normal function, without interruption, then your entire body is at risk for other conditions, systemic conditions like the diabetes that Dr. Ariz mentioned before. So, Tom said he has sleep apnea. Tom's over in Lemon Grove, and he's wondering what the different levels of sleep apnea, obstructive sleep apnea, really mean. Is that important, or is it just important that you have sleep apnea?
Well, we have different categories. It starts with mild, moderate, or severe, depending on the sleep report that is obtained by the sleep lab or by the take-home machine that we provide to our patients. And these reports are interpreted by sleep physicians. And it's imperative to know that a number of AHI or apnea-hypopnea index, for example. And when the patient takes the take-home machine and sleeps with 1 or 2 nights, and we're able to get that result interpreted effectively. So if you, for example, have a body mass index of, let's say, over 28, and your neck size of 17-inch for men and 16-inch for women, and if you answered any of the previous 5 questions that I've mentioned earlier, we have an increased risk of moderate to severe apnea for that individual.
So now, I have this question, Dr. Ariz, because I get it a lot when patients do email from our website or give us a call, that they wonder if they can be treated with an oral appliance if they are severe apnics, or are they limited only to using the CPAP? And if that's the case, is there anything we can do to help them wear the CPAP?
Right. Well, one of the most important ways the patient can start is by losing weight, because as you lose weight, the extra pounds you actually shedding off reduces the weight, which can help you sleep better, and even reduces the tongue size. And as a result of weight loss, you're improving the quality of your lifestyle. If we were seeing a patient that has mild to moderate obstructive sleep apnea, then one of the recommended methods is using their oral appliance to hold the jaw and the tongue in such a way that prevents a collapse of the airway. Whereas we mentioned before, night guards do not do that. For a patient who are in severe categories, then the recommended treatment plan is, of course, PAP. But if the patient are CPAP intolerant, for example, they hate to use the machine or they don't want to use the machine, then yes, we can improve their sleeping quality by incorporating the oral appliances that we have along with the machine. And or if they are not that severe, if they're moderate, then definitely the oral appliances can help them to get a better night of sleep, for sure.
So now I have a question that Tom's back with us. If you lose weight and you're already diagnosed with sleep apnea, might you go from severe to moderate or mild and then just be able to wear an oral appliance?
Yes. Yes, the answer is yeah, for sure. Absolutely. If you have been told by your doctor or pulmonologist or a sleep doc that you must use equipment and you are not compliant, then you are what we call CPAP intolerance, and you may be a candidate for oral appliance, as I mentioned earlier, or a combination of both CPAP and the oral appliances, which is called a hybrid appliance. Yes.
Okay. So then, final question here about the sleep apnea patients is how do you, in your practice there at TMJ and Sleep Therapy Center of San Diego, help the audience of listeners here who are paying attention to your information?
Well, I treat my patients by thorough evaluations, which I think we went over that earlier. And we evaluate their sleep behavior and whether or not they have any signs or symptoms of craniofacial head and neck pain. We do our head and neck examination. If this is very closely related to improper nasal breathing, which is very important, we pay attention to that. So we are able to diagnose truly what causes the patients to have improper sleep experience and clenching and grinding. And as we know, normal breathing is through nasal functional breathing. And when that is impaired or when that is not sufficient, then we become a mouth breather because we open our mouth, and that puts stresses on the orofacial and craniofacial muscles. So we become clenching and grinders. So that creates jaw problems and forward head posture, neck and shoulder problems. So it goes on and on and on because we just, nobody just ever looked at the cause of the problem. So we pay a lot of attention into that factor. As a matter of fact, this morning we had a patient that came in from her physician, and she wasn't sure exactly why she's in her office because she had a crown recently replaced. And through my evaluation, we found out that yes, she does have obstructive sleep apnea, which needs to be evaluated, and she's gasping for air. She's not breathing comfortably at night, and she's waking up with headaches in the morning. She has shoulder and neck pain, and we were able to help our patients because even though they may come in through something that is unrelated to their needs, but we are able to find that what really needs to, we can help them differently.
That speaks perfectly, Dr. Ariz, to responding to who we are and what's different about us. There are a lot of dentists, well-intended, treating conditions of temporomandibular joint, or TMJ, most commonly with splint appliance type of therapy. And there are a lot of dentists who's treating dental sleep medicine or obstructive sleep apnea with oral appliances. The difference with the TMJ and Sleep Therapy Center is that our doctors understand the complexities of both conditions and how they are interrelated. It's very hard to separate the two. If you have a joint problem and are having pain or problems functioning, you can't open, you make noises, your jaw locks, that is true TMJ problems. Using that term is fine. We want to help you. But for long-term results, we need to find out why are you having those problems. And our doctors understand, again, the complexities that are comorbidities of these two conditions, and they want to check both to provide the best long-term care for you. Positive results, long-lasting. If you have a joint problem and you're going to receive the therapeutic non-surgical rehabilitation that Dr. Olmos provides and has offered in all of our centers, and Dr. Ariz is there doing as well, then you need to be able to wear the appliances and sleep well to heal. Breathe, sleep, heal, live. That's what our tagline is. That's what we truly believe. That's what we seek to provide for all of our patients. If you're not in pain and you have sleep apnea, then certainly oral appliances are an option, but the joint needs to be evaluated to make sure that it's healthy and can support the wear of the oral appliance for successful treatment. So our doctors combine all of their knowledge and look at all entities that could be involved in either or any of the conditions to ensure the patient gets the optimum care and most long-lasting successful result. So that brings us to a question that I'd rather you answer, Dr. Ariz, but I think I'm going to have to do this one. And it's about insurance. So we all have insurance, we need it, and we want to be able to use it. At TMJ and Sleep Therapy Center, we understand the importance of that. The reality is, however, that most of us don't truly understand our insurance provisions, the benefits, how it works, like deductibles, percentage of copayments, criteria for predetermining in advance, limitations and exclusions, claim submission based on previous criteria. It's very confusing. We are able to help, but we want to make sure that our patients first understand how the insurance works so that we are not misleading or misrepresenting to get them started in treatment, and then later our benefits not available or very limited. So, number one, we always inform our patients that our doctors have chosen to not contract with insurance. However, we do everything to help our patients receive any benefits that are available through their insurance. I'll explain this a little more. Dental insurance does not provide benefits for sleep apnea treatments by a dentist using an oral appliance. If you think about it, it's just very logical. The dentist is the appropriate person to design an appliance to wear over the teeth in the mouth to address a sleep apnea condition. But it has nothing to do with the teeth, and therefore the dental insurance rightfully does not cover. In the future, we may see that dental insurances offer like a jewelry rider. It's a sleep medicine rider on a dental plan. But at present, there are no benefits or codes that can be used to bill a true sleep apnea appliance for a diagnosed OSA condition to dental. With that said, we help patients with medical. With TM joint conditions, there are a few dental plans that have some benefits, but they are for splint therapy, which we have found does not provide the success in treatment in the same manner as the orthopedic appliances that Dr. Olmos designed and uses in all of his centers. And so we, again, use medical to assist the patient. Medical insurance is not something that can't be used in a dental office if the condition is medical. And craniofacial pain, headaches, structural problems with the joint and the airway, these are medical in nature. They're properly treated by a trained dentist. Our dentists are both, all of our dentists, the two that are speaking for TMJ and Sleep Therapy Center in San Diego, Dr. Olmos and Dr. Ariz, are board certified in both craniofacial pain and dental sleep medicine. That's a high standard that ensures that you're seeing doctors who are trained and have been treating and having cases reviewed for board certification, and you're receiving the best care. Of course, that does not mean another dentist can't treat you. I'm just helping to point out the differences. There are I think it's over 150 different oral appliances for sleep apnea. So you certainly want a doctor who can determine your individual needs and design an appliance that will work for you specifically, and that's what our doctors can do. To bill the insurance, absolutely, we will provide the help in doing that, but we would not misrepresent that the insurance will directly pay us. The reason our doctors have chosen to not contract is that insurances can make decisions, if you're contracted, as to what treatment you, the doctor, can give your patient. And our doctors, don't feel comfortable directing care that the insurance company has determined is best for the patient when the patient hasn't been seen, evaluated, touched, examined by anyone at the insurance company. The doctors feel their responsibility to the patient is to direct the best care and assist with any benefits that are reimbursable to them, but not to direct the care based on the benefits the insurance company feels the patient should have for treatment the insurance company directs. So again, we all know we need insurance. It's very important to us. When it comes to catastrophic things that happen in our life, conditions that require hospitalization, surgery, long-term care, oh my goodness, where would we be without our insurance? So we are not negating the importance of insurance. We're just saying that you need to understand what your insurance provides and know that a doctor may choose to direct the care that he feels is best, that your insurance company may say is not what they want to cover. So we don't ever mislead. We let you know right up front that we'll do everything we can to help you. We'll find out what your benefit structure is, what your deductibles are. Some people don't even know what a deductible is, and that's understandable that we're not trained in insurance as lay people. But your insurance plans, whether you purchase them yourself based on what a broker explained to you, or they're part of a benefit package through your employment, they have parameters and criteria, and they have amounts that the patient themselves must pay first before the benefits of the insurance plan begins to cover treatments that are submitted. So there are different plans, different companies, all of them well-intended, Blue Cross, United Healthcare, Cigna, Aetna, and then the HMOs like Kaiser and Sharp. All of them are well-intended to provide care for patients, to keep it cost effective, because that is, of course, something they have to manage, and to keep the premiums that either you or your employer pays reasonable. There are certain things that are not covered, or certain plans that have very high deductibles. We all know in the past years it's changed greatly here in our Southern California area, and deductibles, which have to be met by the patient, can be from $1,000 to $10,000. So you have a lot out of pocket before the insurance kicks in. And we just want to make sure we do not mislead you about how the insurance will help you. But by all means, we will help you receive whatever benefits are available.
Be sure to listen to Breathe, Sleep, Heal, Live every Saturday at 11 a.m., where you will hear from the experts at TMJ and Sleep Therapy Center of San Diego. Visit us at tmjsleepsd.com and learn more about treatments for chronic pain and sleep breathing disorders. Or if you have any questions you would like us to address on the next show, please email us at info@tmjtherapycenter.com.